It's a procedure that a lot of people are turning to improve their quality of life. We're talking about stem cell therapy, and here to shed some light, we welcome Dr. Tamara Rogers and her patient, Miss Carrie Garcia. Carrie, welcome. Doctor, good morning.
Good morning.
And Carrie, I'm really excited to hear your story. But before we get to that, I want to go with you, Doctor, and tell us, Dr. Rogers, what is stem cell therapy? I'm not very familiar with it, and I think maybe some people at home would want to know as well.
Yeah, so basically stem cell therapy is being able to use your own stem cells from your body, which we actually harvest in our clinic, and then we're able to take those cells and we re-inject them wherever you're hurting. So your knees, we can do it in IVs for autoimmune diseases, we can do it in the bladder like we did with Carrie. So we're able to use your own healing properties, which there's been some controversy. So we don't use embryonic, so it's not going to be from, potential baby tissue. We're not going to use umbilical cord, which would be from somebody else. So we're not going to have that worry of rejection of using somebody else's blood products.
So what is the difference between using your fat as opposed to bone marrow?
Right. So this one, I brought this just to show. So when we do an initial, we do a little micro, basically liposuction in the clinic, and we're able to get, your stem cells would basically be here, and when we spin that, and then we're getting this from your fat, which is shown here, and then we have, this would be bone marrow. So if we were to look at, and we were to go to treatment, now this right here would be a knee that you're seeing on the screen right now, right? And so with the knee, you can see before there's very little cartilage space. Then after we put the stem cells in there, now you can see that space is opening up, so that's where the stem cells have helped that cartilage to grow. And that is what's so incredible, especially we see amazing outcomes when we use stem cells for joints, and we could basically put the stem cells into any joint that we want.
It's coming from your own body, and that pain, I can only imagine from the bone rubbing together. Now, who is a good candidate for a procedure like this?
So basically, almost everyone, but we do practice under an IRB as far as the procedures, but people with autoimmune disease, rheumatoid arthritis, you've got lupus, alopecia, Crohn's disease, people that have interstitial cystitis. We have, our very own Dr. Askew, who has psoriasis that we can treat. And now we have actually banking. So we will take some of the fat, send it to a banking center, and now you can even get 15 to 20 more treatments right there in our office with one procedure. And you're not having to go to Mexico. You're not having to go somewhere else. You're going to have physicians that are going to see you, process it right there for same-day treatment, and then we're going to take care of it.
And right there with you, no having to go anywhere else.
Don't have to go anywhere else.
All right, Carrie, now I'm curious to talk to you and find out your story. What symptoms were you experiencing?
Well, I had two conditions, and I had them treated in two different delivery methods with stem cells. I had a very audible wheeze, shortness of breath, asthma, chronic lung infections. I used two common inhalers, Advair and albuterol, and honestly, I don't use these at all anymore.
Not at all?
Not at all. So that's been a huge improvement because I can take the stairs at work, I can take a walk in my neighborhood up hills, no shortness of breath, so it's been a really marked improvement there. My other condition was interstitial cystitis. That's an inflammatory condition of the bladder. It was lifelong, really affected my quality of life. And so we did the stem cells injected right around the bladder, and
you loved it. I mean, you could say you can highly recommend it.
Well, yes, because I can run errands now without trying to figure out where my next pit stop is. I can get on an airplane in comfort. I'm just so much more comfortable. It's really helped both conditions.
You guys can actually visit them at their two locations with Dr. Rogers. She is in 1604 and Redland, and also on 24200 I-10 Leon Springs. You can call 210-871-0077 or visit online, drrogerscenters.com. Carrie, thank you so much for sharing your story, and we appreciate you, Dr. Rogers.
Yes,
Take
good
care.
to see you.
Good to see you. Don't go anywhere. We'll be right back with more Great Day of Safe.